A lot of people have the idea that males and females are the exact opposites when it comes to anatomy and physiology. Well, I'm here to convince you otherwise. I'd argue that male and female reproductive systems are more parallel than you'd initially think. This video is on the female reproductive system, with a focus on how form follows function with the major female reproductive structures, while we dabble in a couple of things that you might have heard of, might have been afraid to ask, but can make a lot more sense of when you're armed with some science. In our last lesson, I explained that the male reproductive system was all about sperm, producing, storing, and releasing sperm. Well, the female gametes, or reproductive cells, are eggs. So the female reproductive system produces eggs, stores eggs, but it doesn't release eggs externally. So what's the parallel there? Well, instead of releasing eggs externally, the female reproductive system provides the site of fertilization, the meeting place for sperm and egg cells. Then, once the fertilized egg or zygote is made, the female reproductive system provides protection and nutrition for the growing fetus and even nutrition for the baby after it's born. Just like we classified male reproductive organs into essential organs or accessory organs, female reproductive organs can be classified the same way to help us keep track of everything. Furthermore, the accessory organs can be subdivided into the categories of ducts, glands, and supporting structures. Let's start with the essential organs, the organs that make the gametes or sex cells. In females, it's the ovaries that are responsible for making eggs. There are 2 ovaries, 1, 2, and they're about the size of almonds and weigh about 2 to 8 grams normally. And in addition to making egg cells or oocytes, ovaries are also in charge of making the hormone estrogen. Another fascinating thing about the ovaries is that they are really stuck to the hip bones with ligaments. Check out all the ligaments that keep ovaries in place. It's like Spider-Man sprayed these broad ligaments in place to keep the ovaries protected by attaching to the pelvis. And then there are suspensory ligaments and ovarian ligaments to keep the ovaries in place too. All right, let's move on to the ducts or tubes of the female reproductive system. There are 3 that we need to keep track of, and those are the uterine tubes, the uterus, and the vagina. Here are those female reproductive ducts on the diagram from our book. I've drawn, just to make it easier to see, the uterine tubes in blue, dark blue right here, the duct-like part of the uterus in green right here, and the vagina in light blue right here. One thing that is different about the male and female is that in the male, we said that the urethra was a male reproductive duct, a common passageway of urine and semen, but not in the female. In the female, the urethra strictly connects the urinary bladder to the outside to get urine out. But in the male, the urethra had that dual function of transporting urine and semen, but in females, the urethra has no reproductive function. I feel like this diagram gives a different and clearer view of the female reproductive ducts. So we've got the uterine tubes on either side here, leading to the uterus, and then finally the vagina, which is right down here at the bottom of the screen. All right, let's check out those uterine tubes. So sometimes the uterine tubes are called fallopian tubes or oviducts, and each uterine tube is about 4 inches long. So if you set out your palm, that would be like the distance from the tip of one of your fingers to like the middle of your palm. And a cool thing about the uterine tubes from a form follows function standpoint is that the end that's closest to the ovaries has these structures called fimbriae. Fimbriae are finger-like projections of the uterine tubes, and those fimbriae expand along the opening of the uterine tubes towards the ovary, and it makes the uterine tube better at its function of kind of like catching the egg, catching the oocyte, and moving that oocyte into the uterine tube towards the uterus. So once in the uterine tube, those epithelial cells of the uterine tube, they're ciliated. So once in the uterine tube, the cilia rhythmically move to sweep the egg towards the uterus. Now, the uterine tube is actually the normal site of fertilization. And if everything goes to plan, the fertilized egg, maybe fertilization takes place somewhere in here, and then that fertilized egg gets swept by the cilia towards the uterus. But sometimes, though, the fetus can actually implant and grow in the uterine tube to create a situation called a tubal pregnancy. Tubal pregnancies are really dangerous for the mom because this uterine tube isn't going to get much bigger, and that uterine tube can rupture. And a lot of times those pregnancies have to be terminated. Moving right along, let's talk about the uterus. Like I said, if everything goes to plan, a fertilized egg will be swept down the uterine tubes into the uterus. In a non-pregnant female, the uterus is about the size of a small upside-down pear, so smaller than your fist. Anatomically, the uterus can be divided into the body, which is the superior 2/3, and the cervix, which is the inferior 1/3. One landmark of the uterus is the dome-like top of the uterus called the fundus. During pregnancy, the fundal height can be easily measured by a medical professional with a tape measure, and that gives a rough estimate of the size of the growing baby throughout the pregnancy and whether the baby's in the right position to be born. Now, besides the body and the cervix and the fundus, the uterus can also be divided into 3 layers or uterine walls. There's the endometrium, or the inner layer, the myometrium, the muscular middle layer, and the perimetrium, the outer layer. These layers are where the uterus gets really interesting from a physiological standpoint. The endometrium is the site of implantation. So in other words, what I mean by that, that's where the fetus attaches to the mother. The endometrium forms part of the placenta, which is the structure that provides oxygen and nutrients to the developing baby. And every month, the endometrium thickens, and if fertilization does not occur, the endometrium is actually shed from the uterus, and that's a woman's menstruation or period. Now, the myometrium is a muscular layer, and you can see that the myometrium here is pretty thick, and you probably guessed that it's made of muscle from the root myo. And since this is involuntary muscle, the myometrium is smooth muscle. Now, the myometrium is critical to the uterus function because the myometrium is actually what contracts during labor when a baby is born. So those labor contractions are the myometrium that contract the uterus to push that baby out. And the myometrium also contracts during a woman's period or menstrual cycle to get rid of the endometrium in any month where an egg isn't fertilized. So when a woman has menstrual cramps, it's cramps of these muscles that make up the myometrium. All right, finally is the perimetrium, which is a serous tissue. And this just means that the perimetrium secretes a slippery fluid so that the uterus can kind of like slide around in the guts and not get caught up with any other internal organs. Since we're talking about the uterus, you may have wondered about cervical cancer when we were talking about the cervix. Cervical cancer is a fairly common cancer in women that is very curable if it's caught early. As scientists have learned more about cervical cancer, they've found out that HPV, or human papillomavirus infections, can really increase the rates of cervical cancer. And this is actually why many doctors are now advocating for young boys and young girls to get HPV vaccines. HPV is an infection that can be passed on with sexual intercourse, and a vaccination early on in life, before sexual intercourse begins, can prevent HPV and thus decrease rates of cervical cancer. All right, so how would a woman know that she even has cervical cancer in the first place? Well, cervical cancer frequently has no symptoms at all, but symptoms can include vaginal bleeding or pain during sexual intercourse, and those are kind of like vague symptoms. So it's so common, cervical cancer is so common, that doctors actually check for cervical cancer during a normal gynecological exam. The procedure to check for cervical cancer is called a cervical smear or pap smear. And this test is really common for women, even though it can be kind of like a little bit uncomfortable or embarrassing. Now, to collect the sample for a cervical smear, the doctor inserts an instrument called a speculum into the vagina And the purpose of that is to hold the vagina open. Next, they insert something that's shown here that kind of looks like a Q-tip, and then they rub that along the cervix to collect a sample of cells. And then those cervical cells are put on like a microscope slide, and then they stain it with a dye so that they can see it better. And then a medical specialist, like a pathologist, will look at the sample and they'll see something like this. And they'll see if there are any abnormal cells, like these guys with these big nuclei right here. And typically, women start getting gynecological exams and pap smears by about the age of 21. Now, if the cervix and the cervical cells from the pap smear look abnormal, the doctor will want to take a closer look at the cervix. And this can happen with a specialized microscope that's shown here called a colposcope. A colposcope allows the doctor to get a clear look at the cervix. So you can see here is a normal cervix, and then here's a cervix with an abnormal lesion on it. And now if a doctor saw an abnormal lesion like this, the doctor can kind of like zap those cells right away with lasers or cryo treatment that's just like extreme cold, and that will kill those abnormal cells right away. But before that, the doctor might also want to collect a sample of those cells, that's called a biopsy, to do some further analysis. Now, like I said before, cervical cancer is very curable, but only if it's detected early. So while an exam like this, a gynecological exam, a cervical smear, and a colposcope can be really uncomfortable and embarrassing to think about, all of these medical procedures are really essential for good reproductive health. All right, now, the third reproductive duct that I mentioned is the vagina. And although people seem to talk about the vagina all the time, physiologically, I think the vagina is kind of pretty boring. So as a duct, the vagina connects the uterus, which is right here, to the outside. And it's kind of just like a tube that transports menstrual tissue out if there's no fertilization, or provides a pathway to get out for the baby to get out, if there's a pregnancy, for the baby to get out of the uterus. Now, in sexual reproduction, the vagina provides lubrication and stimulates the penis, and all of that, like the goal of that is to provide like muscle contractions so that semen can be propelled further from the vagina into the uterus, into the uterine tubes, to increase the chance of fertilization. All right, so back to our summary table. Now that we've talked about ducts, let's move to the supporting structures called the external genitals. Collectively, the external genitals can be called the vulva and include these four structures right here on our diagram: the clitoris, the labia minora, the labia majora, and the vaginal orifice. The labia are coverings of the female genitalia that serve a protective function for external and internal female genitals, including the clitoris and vaginal orifice. The vaginal orifice is simply the external opening of the vagina, and the clitoris is a small organ of erectile tissue. So kind of like how the penis gets erect, the clitoris gets erect, and that responds to sexual stimulation to like ultimately can trigger muscle contractions that move semen up the female reproductive tract from the vagina to the uterus to the uterine tubes to increase the chances of successful fertilization. So this leads us to the glands. Now, what are the glands of the female reproductive system? Well, some of the main ones are the mammary glands. Of course, the function of the mammary glands is to produce milk for the baby after the baby is born. And mammary glands will be a focus of our next lesson on pregnancy, labor, delivery, and care of the newborn.